So good morning, everyone. Thank you so much for joining us today. We know that you have a lot of asks of your time, especially these days, and so I really appreciate you all sharing it with us. I'm Laura Wilhelm. I'm the Executive Director of Disability in Chicagoland, and we are thrilled to be partnering with the Shirley Ryan Ability Lab and the Rehabilitation Research and Training Center at the Employment for People with Physical Disabilities to share with you a really important discussion with really a national expert, Lou Orslene from ODEP at the Department of Labor. And things changed so quickly in March with the onset of the COVID-19 pandemic. And I think initially, so many organizations were very focused on what do we do quickly to ensure that we can keep moving. And now that we're several months in, a lot of companies are trying to figure out, well, where do we go next? And how do we think about what the right transition is to move people back into work, whatever that means, whether it's in a physical office or not. And so we're thrilled to be able to offer this discussion today. And we are really pleased that you joined us. So Angelica, if you'd move to the next slide. I just want to go over a few logistics with you before we dig in. First of all, we've muted your lines as you enter. So just so you know, your lines are muted. If you have a question, we are going to leave some time at the end of the presentation for some Q&A. If you have questions, please type them into the chat window. And if you can't see the chat window, there should be a menu on the bottom of your screen. And there should be a little bubble that says chat under that. If you click on that, then you can type questions and answers into there. You can either send them to everyone or just send them to me, Laura Wilhelm, and I'll watch for those questions during the presentation and then share them with Lou once we hit a little bit closer to the end of the hour. I also just want to let you know that we are captioning this presentation. If you don't see the captions on your screen at the moment, if you look to that same toolbar at the bottom of your screen, you'll either see a button that says CC for closed captioning, or you'll see a button that says more with 3 dots above it. If you click on either of those buttons, you should see an option that says show subtitles. And if you click on that, then the captioning will appear at the bottom of your screen. Finally, I just wanted to let you all know that we will be sharing the slides and we are recording this webinar. So I know sometimes people have to come and go and there's going to be so much good information shared here that we will share that with you as a follow-up to today's presentation. So if you want to move to the next slide, I am going to introduce Deborah Crown, who is the project manager at the Center for Rehabilitation Outcomes Research at the Shirley Ryan Ability Lab. She is going to talk a little bit more about the program at Shirley Ryan Ability Lab. Although I noticed I jumped over really quickly, I want to give a couple, would you go back to the last slide, Angelica? I'm sorry about that. I do want to just quickly give a couple points about Disability in Chicagoland. We're an affiliate of Disability In, which is a national nonprofit. It's a resource for businesses on disability inclusion across the United States. We're really the only local resource in the Chicago area, and we're really all about helping businesses come together to build a network to support disability inclusion in the workplace, marketplace, and supply chain. And we do that through things like today's webinar. We want to provide engagement. We want to provide opportunities for connections among those internal disability inclusion champions within large organizations. And we want to be able to connect you to resources to make it easier for you to build a culture of inclusion within your organization. So we're doing this presentation today. I also will just give a quick plug. We're planning, typically we do an in-person event every October, and this year we're going to move it virtually. So we look for some more information from me on a virtual event series coming in October. So now, if you'd move to the next slide, please, I am going to turn it over to Deborah to share some information about the Rehabilitation Research and Training Center. Deborah?
Thank you, Laura. So the Rehabilitation Research and Training Center for Persons with Physical Disabilities is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. We are in our second year of a 5-year project, which addresses issues related to chronic unemployment, and underemployment for people with physical disabilities. The center also includes a robust set of education and dissemination activities, which includes a sponsorship of speakers such as Mr. Orslene's. There are 4 research projects under this center, and the purpose of the research is to create best practices to help people with physical disabilities maintain employment, which then leads hopefully to enhance self-sufficiency and improved quality of life. I've provided the website for our center, so if you'd like to get more information, please do check out the website. There's a nice list of employment resources available at our website and some videos of previous training sessions we've provided. I also wanted to recognize our principal investigator for the RRTC, Dr. Alan Heineman. He's in attendance today. Also, I wanted to recognize Dr. Linda Ehrlich-Jones, who oversees the training and knowledge dissemination activities for the center, which includes the webinar today. And then next slide, please. I wanted to highlight our collaborators for the RRTC, which includes the Shirley Ryan Ability Lab, but also Northwestern University, the University of Washington Department of Medicine, the Northwest ADA Center, the University of Illinois at Chicago, and the Great Lakes ADA Center. And now I would like to introduce our collaborator and the director of the Great Lakes ADA Center, Robin Jones.
Great, thank you very much for the invitation and for the opportunity to be here today. My pleasure to be able to introduce our presenter today. Can you go to the next slide? Thank you very much. And we are pleased to be able to have with us, and the advantage of being in the virtual world is that we can bring people from other places, even when we don't have travel opportunities right now and such. And it's Louis Orslene's, and he is currently the director for the Employer and Workforce Policy Team within the Office of Disability and Employment Policy at the U.S. Department of Labor. This particular team, the employer team, examines the policy issues and barriers facing employers as they seek to recruit, hire, retain, and advance individuals with disabilities in the workplace. Prior to coming to ODEP, Lou has had some other positions. I've known Lou for a long time. I don't even know how many years if I was to count it up there, Lou. But he has previously served as the Disability Policy Advisor, supporting the Department of Defense Office of Diversity, Equity, and Inclusion. And he also, for many years, served as the co-director of the Department of Labor's Job Accommodation Network, or JAN. Lou has extensive knowledge in the area of employment, accommodations, and such, and you can read his full bio, which was provided as part of the promotional materials for today. But in order to just move us along, at this point, I'm going to go ahead and turn over the microphone to you, Lou.
All right, great. Thanks very much, Robin. And we're also very appreciative to the Shirley Ryan Abilities Lab and all the great partners who really provided this opportunity for me to speak with you today. As Robin said, I'm Lou Orslene from ODEP. The Office of Disability Employment Policy is a non-regulatory agency that partners with employers and all levels of government to promote disability-inclusive policies in practice. And it's important, as always, to note that we do not provide legal advice. In terms of what I hope to impart you with in the next 40 minutes, as we're in the 30th anniversary of the ADA, I really want to first remind us of the 4 pillars of the Americans with Disabilities Act. And I want to ask all of you to recommit to these original tenets of the landmark legislation that really has so significantly impacted all of our lives, as well as the lives of the people that we serve. I hope too to convey an understanding of the analysis needed to successfully navigate the accommodation process during COVID-19. I know that many of us are challenged with this difference in terms of looking at the accommodation process and looking at teleworking, specifically when it has to do with people with disabilities. And finally, I've prepared several slides of resources at the end of the presentation to support your decision-making in these challenging times. Next slide, please. So clearly, 2020 is going to be remembered for a lot of things, but not all of them are welcome. But on the positive side, this year is the 30th anniversary of the ADA. So throughout 2020, we at DOL are observing the anniversary through a variety of activities, all centered around the theme of increasing access and opportunity. And you'll see many of these activities, of course, later in the year during National Disability Employment Awareness Month. As a reminder, the ADA was signed into law July 26, 1990 by the late President George H.W. Bush. The ADA is the landmark civil rights legislation that works to increase the inclusion of people with disabilities in employment, state and local government services, public accommodations, and telecommunications. It has 5 sections, all called titles, that relate to each area, different areas of our lives. We at the Department of Labor are committed to delivering the promise of the ADA, not only for today's workers with disabilities, but also future generations. So we're really pleased to recognize its 30th anniversary. Can we go to the next slide, please? I think in the year of the 30th anniversary of the ADA, it's important to really just take 1 minute and revisit the 4 pillars of the ADA. The work that so many of us have been doing and continue to do is really supported by these 4 pillars. They include full participation in all aspects of community life, equal employment to enjoy access to public and private spaces, independent living and the inclusion of choice in deciding where one wants to live, economic self-sufficiency and full inclusion into our workplace. Each of these pillars signify significant struggles and applications over the past 30 years. And the one that we really continue to struggle with, and the reason we're here really today, is economic self-sufficiency and employment. So now let's talk about the Title I of the ADA. The next slide, please. So again, reminding us that the purpose of the law is to make sure that people with disabilities have the same rights and opportunities as everyone else in our workplace. Title I of the ADA addresses employment. While ODUP doesn't enforce the ADA, every year we provide technical assistance to tens of thousands of individuals and employers on the law's employment provisions. And more importantly, the spirit of the law infuses the work of our entire department as we work each day to ensure all Americans can prepare for and succeed in employment. The ADA forbids discrimination when it comes to any aspect of employment, and that includes hiring, firing, pay, job assignments, promotions, layoffs, training, fringe benefits, and any other term of condition of employment. The ADA requires an employer to provide reasonable accommodations to employees and job applicants with a disability, unless doing so, of course, will cause significant difficulty or expense, known as undue hardship. If we could go to the next slide, please. So it's important really for us to understand workplace disability discrimination and what the ADA covers. So really, disability discrimination occurs when an employer or another entity covered, for instance, a union, by the ADA treats a qualified individual with a disability who is an employee or applicant unfavorably because he or she has a disability. So disability discrimination also occurs when a covered employee or entity treats an applicant or employee less favorable because she has a history of disability. For instance, a past depressive episode. Or he or she is believed to have an actual or perceived impairment. This is called the regarded as clause. So these are really the 3 prongs of the ADA. The law also protects people from discrimination based on their relationship with the person, even if they do not have themselves a disability. For example, it's illegal to discriminate against an employee because her husband has a disability. The next slide, please. So the ADA is relevant to the COVID pandemic in at least three major ways. First of all, it regulates covered employers' permissible disability-related inquiries and medical examinations for all applicants and employees. It also prohibits employers from excluding individuals with disabilities from the workplace for health and safety reasons unless they pose a direct threat. Reminding you, of course, that this is a significant risk of substantial harm, and that's actually the definition of direct threat. And one has to be a direct threat to themselves or others. It also requires reasonable accommodations for individuals with disabilities absent undue hardship. If we can go to the next slide, please. Now, with respect to medical inquiries and medical exams administered to employees, practices that take into consideration the impact of COVID-19 and are consistent with the ADA include adopting COVID-19 screening protocols that are implemented consistent with advice from the CDC and from public health officials for a particular type of workplace. And these may include medical inquiries and medical exams for all employees, and I stress all employees, before they enter the workplace to determine if they have the virus. So this would help us in determining whether that person poses a direct threat to themselves or others, or at a higher risk of developing complications from the virus. Again, this is perhaps the direct threat to themselves. And also requiring information about all employees returning to the workplace after visiting a specific location, whether for business or personal reasons. So asking employees, including employees who are absent from work or call in sick, if they're experiencing symptoms of COVID-19, such as fever, chills, cough, shortness of breath, sore throat, or loss of smell or taste, if these symptoms have been identified through the CDC and other public officials. So it's totally appropriate in these circumstances and consistent with the ADA to then ask people more information about that illness. Next slide, please. Other practices that take into consideration the impact of COVID-19 and again are consistent with the ADA include measuring all employees' bodily temperature. And it's important to note that some people with COVID-19 do not have a fever. Administering valid and reliable COVID-19 tests to employees before they re-enter the workplace to determine if they have the virus. And not using antibody tests to make decisions about allowing persons to return to the workplace, because we know that this has not yet been perfected and there are too many tests that are really not valid. If we could go to the next slide, please. Now, with respect to maintaining the confidentiality of inquiries and medical information obtained, practices adopted by employers that again take into consideration the impact of COVID-19 and again are consistent with the ADA include maintaining all information about an employee's illness related to COVID-19 as a confidential medical record. This includes results of daily temperature checks. It also includes an employee's statement that he or she has the disease or suspects that he or she has the disease, and employer notes or documentation from questioning an employee about symptoms. Storing all medical information about a particular employee separately from the employee's personnel record, thus limiting access to this confidential information. And this really isn't anything new to all of us who are steeped in the ADA and reasonable accommodations. All of this information, all accommodation information always needed to be stored separately from the personnel file. But it does mean that at times disclosing the name of the employee to a public health agency when it learns the employee has COVID-19, more than likely is covered. And what really one needs to think about that is it's on an as need to know basis. So your public health agency is as need to know, and of course, if they request that information for tracing and other strategies, then you will need to provide that. Next slide, please. So at times, COVID-19 creates challenges for people with disabilities in getting the medical information they need to substantiate their disability. We've heard that numerous times from numerous people that, meeting doctor's appointments, setting up doctor's appointments in this time, all are creating real challenges for people. So first of all, it's just important to remind all employers that there is no requirement to get medical documentation. If you are confident that that person, the information that they have provided is enough to move forward, then please do move forward. Perhaps your process has a requirement to get medical documentation, but there isn't any in the law or regulations. But again, if your process requires it, then consider using a temporary accommodation while you're awaiting delayed medical information. You can acknowledge this accommodation is temporary, that it's not the final word on this, and as things change with a pandemic, that this may change as well. But the point is here to always show good faith in these circumstances. If we can move to the next slide, please. So if there's some urgency in providing accommodation, like my experience in the Pentagon, whenever someone was diagnosed with COVID-19 and immediately everyone was dispersed and sent home, you may have requests from people with disabilities that are now teleworking. And there's perhaps under the prior circumstances, there was no need for accommodation, or they didn't have to ask for an accommodation. But me now at home, using various communication technologies, and perhaps I have a hearing impairment, or perhaps I'm deaf, that changes the situation significantly. So if there's some urgency, I'm sent home immediately, but yet need to still ensure I meet my essential functions of my job, then the employer may forego or really shorten the exchange of information, which was what we call, under the law and regulations, the interactive accommodation process, or the interactive process. And what we may decide to do is really opt to provide and request accommodation on an interim trial basis with an end date, while awaiting receipt of more comprehensive medical documentation. Employees may also request an extension to get medical information. So just be aware that you may be getting those requests. In this case, employers should consider the request, particularly if government restrictions are extended, or if new restrictions, considering the current surge in many areas, new restrictions are adopted. So if we can go to the next slide, please. So in fulfilling their obligation to provide reasonable accommodations for their employees, employers may want to adopt the following practices that take into consideration the impact of COVID-19, and again, consistent with the ADA. So we may want to offer protection to an individual whose disability puts the individual at greater risk for COVID-19, and who requests such actions to eliminate possible exposure. We may want to discuss with an employee whether whether this is the same disability that they've been accommodated for previously, or this is a different disability, is the basis for the new request. And then we'll know, as we go through the interactive process, then of course, we know this is a different situation. We need to ask a different set of questions and base the accommodation solutions on the analysis and the additional information that we receive. So it's real important not to just assume that just because someone asked for an accommodation in the past based on a specific medical condition or chronic health condition, that's indeed what they're speaking about this time. It may be that the new situation, the move, the stress of COVID-19, we're now talking about an additional, say for instance, mental health condition that that person's experiencing. So we need to go through the analysis and the interactive process with that perspective. Now, for the most part, the interactive process looks the same as it does during ordinary times, right? We'll still recognize the accommodation request. We will gather information. We'll explore these various accommodation solutions. Then, of course, the employer, supported by the medical professional, chooses that accommodation. Then, of course, we implement and then monitor accommodations. And the best way to monitor an accommodation and whether it's working effectively, right, is the person able to perform their job? So that's the kind of monitoring that we need to put in place. Now, if there's urgency in providing the accommodation, as we spoke before, then the employer may grant a request or opt to provide a reasonable accommodation on an interim or trial basis. And if you go online at the Job Accommodation Network, there is even a form that you can use for trial basis. This is one that has always been used in the workplace, a trial basis. If you're unsure of an accommodation will or will not work, then employers have always felt comfortable with doing an accommodation on a trial basis so that they're not locked in, and so that there is the, everyone is aware that we are trying this out to see if it'll work. So that would be a form that one would use now, a perfect time actually, if you're providing a requested accommodation during COVID-19 on an interim basis. And on that form, you'll also indicate the end date. And you may want to indicate too that this is until you're awaiting more medical information or additional information on what may or may not work. At the EEOC website dedicated to coronavirus at www.eeoc.gov/coronavirus, it says the following: employers may wish to adapt the interactive process and devise end dates for the accommodation to suit changing circumstances based on public health directives. So if I haven't been clear here, this really does grant the employers this right to provide an interim or trial basis accommodation. And which really means then that the employee is not entitled to that accommodation after the pandemic ends or after the pandemic significantly subsides. So, it's just the fear of a lot of employers that, I've granted telework through this period, but it's not sustainable, and that's really not my preference in the way that our office works in the future. So just know then you can offer telework during this period as a trial basis interim accommodation, and that you can renegotiate that once the pandemic ends. If we could go to the next slide, please. In order to prevent the transmission of COVID-19, practices that take into consideration the impact of the virus and are consistent, again, with the ADA, including employers requiring employees to wear protective gear for masks, for example, masks and gloves. And I'll hit on the mask issue just a little bit harder later on in the presentation. Observe infection control practices such as social distancing, regular hand washing, coughing and sneezing etiquette, proper tissue use and disposal, and other measures in the workplace. We may also expect employees to leave the workplace if they become ill with symptoms of COVID-19. Also expect them to stay at home if they have these symptoms. And employers may also require employees returning to the workplace to provide a doctor's note certifying fitness for duty, and alternately may rely on new approaches, such as reliance on local clinics to provide a form, or really just an email certifying that the individual does not have the virus when they have been tested. So, again, it may be a challenge getting this medical information, but again, being flexible and creative, as you've all been, right? I mean, if you provide accommodations, it's all based on flexibility and creativity. So you may have to be a little creative in getting that information from from the medical professionals. If we could go to the next slide, please. All right, so for jobs performed at the workplace, the following are just a few examples of reasonable accommodations that we have heard employers offering and employees accepting. So again, these reasonable accommodations are included for those who request protection due to pre-existing disabilities that really pose a higher risk from COVID-19. And again, as a reminder, I think I said it earlier, but the CDC does have such a list if you want to rely on that list. But let's just go over some of the related accommodations. So one is designating one-way aisles, using plexiglass, tables, or other barriers to separate people. We want to look at modified protective gear for jobs requiring such gear. For jobs requiring employees to wear protective gear, if an employee asks for an accommodation due to a need for modified gear, discuss the request and provide the modification or alternative means if feasible. And this may mean that you want to look at non-latex gloves instead of latex gloves, you know, say for instance in a healthcare environment. You may want to look at modified face masks for interpreters. So there are a number of companies right now, although I've heard that there is no supply currently, but you know, there are probably 4 or 5 vendors these days that are providing the clear masks for people who either that can, you know, ask their colleagues to wear them because perhaps they are lip readers, or if they are using an interpreter, that's where these modified clear face masks may come into account. Or perhaps gowns designed for individuals who use wheelchairs. We may look at temporary job structuring. So, you know, this may be a time when we really look at renegotiating away those marginal tasks and the person just performing at home, teleworking the essential jobs of their task. Or if you really want to, if this is really talent that you've invested in, then you may even want to consider modifying the essential functions. I mean, you as an employer certainly have the right to do any of that. While you don't need to do it under the ADA and the law, you know, it certainly shows good faith during this very challenging time. You may also want to consider temporary transfers to a different position or to a different location. Telework, as I've been talking about. You want to make sure that, that there's effective communication access. So for all employees with disabilities that put them at high risk of complications for COVID-19, you want to offer telework as a reasonable accommodation really to reduce the chance of infection. And as I said before, you want to eliminate those marginal functions. So this is really a good time to look at job restructuring. That really may serve you in the long run. So there are a number, there's a lot of research out there in stay at work and return to work, as well as around the project like Project Search, one of the really successful global replicable models that's really now throughout the world. As I said, it's global, and that all has to do with restructuring. So you may find afterwards, after the pandemic, that this has really served your organization, and you can really look at restructuring units and departments to be more effective at what they do. So going to the next slide, please. Great. The ADA provides covered employees from excluding individuals with disabilities from the workplace for health and safety reasons unless they pose a direct threat. Employers have always been required to base such decisions on fact and not speculation. So of course you need objective evidence to this. If an employer is concerned about an employee's health being jeopardized upon returning to the workplace because of a pre-existing condition identified on the CDC list of conditions that pose a significant higher risk for illness from getting COVID-19, that's quite an introduction to this sentence, the employer may not exclude the employee or take adverse action solely because the employee has a disability on the CDC list. The determination, as all accommodations, must be based on individual assessment based on the factors in the EEOC regulations for determining a direct threat to health and safety or others, and include a determination of whether a reasonable accommodation will reduce or eliminate the direct threat to the employee. So what this comes down to is it's really important that employers must have a reasonable belief based on objective evidence that a specific employee may pose a direct threat. They're not permitted to conduct medical screening or evidence that's been exposed to the virus or exhibiting symptoms. And you may think here, well, just a few slides ago, you told me that I could do this medical screening, right? Well, what we were talking about earlier is all employees, and that's why I was stressing all employees. So it distinguishes between all employees and me specifically looking at one employee and then the actions towards that or with that employee. So that's the distinction here. We're talking about an individual now that we know has a disability or that has one of these conditions on the CDC list. So just to clear that up so that you're not confused. And if a direct threat does exist, then employers must consider accommodations to reduce or eliminate the threat. So just because there is a direct threat, that doesn't simply mean that you can say, oh, just send the employee home. That really means that we still need to think about telework, temporary reassignment, or perhaps it is temporary leave that one takes. But I would caution you, as I caution in all presentations, leave may be the easiest accommodation to provide at the moment, but typically it's not the best accommodation, either by the person or by the company as well. You are losing talent there, and it's better to send somebody home and reduce the amount of essential functions that they're performing, so at least you're getting some work productivity and moving forward on your mission and meeting your work goals. Instead of just sending somebody on leave. Or you may just want to send them on temporary leave until really you figure this all out. How can they work effectively? Or how can they do something else, perhaps supporting another department effectively that they are qualified for? So now let's look at who is really not covered by the ADA. So if we can go to the next slide, please. All right, the CDC does include people who are pregnant among those who are at higher risk of developing severe illness for COVID-19. For more information, you can see the CDC resource information about coronavirus disease, 2019 pregnancy and breastfeeding. And while pregnancy alone is really not an impairment under the ADA, at least under the federal ADA, in some states it's covered, but workers who are pregnant might be able to request reasonable accommodations to avoid the risk of exposure to COVID-19 under the Federal Pregnancy Discrimination Act. So this comes into play. The PDA, the Pregnancy Discrimination Act, is a federal law that protects pregnant workers from discrimination and requires covered employers to make job-related modifications for pregnant employees. So you may want to think about that. Now, of course, an individual who's pregnant who also has pregnancy-related impairments. For instance, there may be that onslaught, and I'm not a specialist, I'm not a medical professional, but I do have sisters. So, I have seen that they have had problems at the end of their pregnancies with high blood pressure or with diabetes, and certainly these may rise to the level of being pregnancy-related impairments that are covered under the ADA. So if they are, then they are entitled to accommodation under the ADA. So of course you have to do your due diligence here and you have to analyze the situation accordingly. Additionally, various state and local laws may require accommodations and include leave rights for workers who are pregnant. And we always suggest contacting the State Human Rights Agency for more information. They typically have a better grasp of your local and state laws. Now, people 65 years and older are also at higher risk for developing complications for coronavirus, but will not qualify to receive accommodations under the ADA solely on the basis of age, very similar to the pregnancy issues. Employers receiving accommodation requests from employees in these higher risk groups, such as pregnancy, or somebody who is over the age of 65, or that, that has a disability, will need to consider their responsibilities under state and local requirements and the Occupational Safety and Health Administration requirements. So just so you know, OSHA has published a guidance on preparing workplaces for COVID-19 that outlines steps employers can take to protect their workforce from occupational exposure to the coronavirus. And this is just really, Robin and I were talking before the webinar, and it's really great to see how many of the agencies, the EEOC, OSHA, CDC, have really stepped up to provide this kind of guidance. But even in that context, it's a lot to go through with employers. I do feel for you. Again, looking at these overlapping responsibilities. And that's what I'm trying to tease out somewhat today, and I hope that I'm doing that for you. Now, another group that's really not covered are caregivers of individuals with disabilities. They're also not entitled to workplace reasonable accommodations under the ADA, but they might be entitled under the Federal Medical Leave Act, FMLA, or the recently passed federal Families First Coronavirus Response Act. So again, you want to look for these overlapping responsibilities and tease that out. For example, if a caregiver's child, spouse, or parent has coronavirus, it's possible that the FMLA would apply if leave is needed to care for the family member or because the caregiver has coronavirus. For more information on this, you'll want to see the Department of Labor's Wage and Hour Division guidance on COVID-19 and public health emergencies and the Family Medical Leave Act questions and answers. So let's just kind of briefly talk about, I'm sorry, on the next slide, please. So let's just briefly talk about 3 challenges that we're hearing of quite often. Masks, of course. I mean, you can't really look at your social media or look at any media without seeing the challenges that we're having with ensuring that people are wearing masks and social distancing. So I really just want to talk about these 3 challenges that we're hearing of, and this includes really wearing masks, providing supports to employees with mental health conditions, and then also talking about people people who are deaf and hard of hearing and who really are expected to effectively telework while some of the tools we're using are not the most accessible. So let's just start with masks. So employees with disabilities who have compromised immune systems, who may be vulnerable to infection, may need to work with their employer to determine appropriate accommodations, right? And masks are often one option to consider. So this is sort of the flip side, where the employee is asking for a mask to protect them because of some sort of threat in the workplace. So whether the employer must allow the use of masks will depend on the situation. As with all accommodations, they're very situational. There may be some jobs that it's really not conducive to use a mask. For example, for those who spend a great deal of time using the telephone during work, there may be difficulty when you wear a mask of others hearing you. If this is the case, the employer must explore alternative accommodations such as private workstations on a case-by-case basis. So according to the guidance from the EEOC, employers may be able to insist that employees, again, now the other side of it, the employees wear protective gear in light of a pandemic. However, they must consider providing modified or alternative protective gear, absent, of course, the undue hardship, if this is needed for the disability. So again, you may be looking at a clear mask, a clear face mask type of mask for people to use. Or you may be saying that perhaps someone can't wear a mask, but then you wear a full shield. That might be the option whenever you do your analysis. Now, employees who are experiencing difficulty wearing a mask due to a qualified disability, which may include mental health conditions such as anxiety disorders, may request a reasonable accommodation. Employers have the obligation to explore accommodation options related to mental health in the same way they do with other disabilities and medical conditions. Ideas might include allowing flexible breaks to receive fresh air, permitting telework, or temporary reassigning to a role that will allow the ability to telework or limit the need to wear a mask. So accommodation solutions should be considered on an individual case-by-case basis, as we always do. The employer's obligation to provide reasonable accommodation is ongoing and really doesn't stop just because one option is not feasible. So you may need to try a few things. And again, this is where the trial basis form comes in. This is where the temporary accommodation comes into play. That gives you that opportunity to try different things. So the interactive process should include additional dialogue regarding alternative to masks, such as telework, leave, flexible scheduling. If a particular accommodation would result in an undue hardship, an employee is not required to provide it, but again, you still have to go through that analysis and you still have to consider other accommodations. So this is a pretty exhaustive process. It's not just sort of your one and done. So, all right, if we can move to the next slide, please. So during these unprecedented times, there's a lot of confusion as to uncertainty about the coronavirus. And of course, this creates a lot of stress, right? Individuals with mood disorders or depression may struggle with isolation. Those with phobias or obsessive compulsive disorder may have increased symptoms and fear. The sudden change of routine really contributes to these issues of concentration, memory problems, increased fatigue and irritability. So ODEP, through its EARN programs, developed a mental health tool. And the tool is really the gateway to background tools and resources that can help employers learn more about mental health issues and cultivate a welcoming and supportive work environment. And it certainly, in this circumstance, these pandemic times, I think serves employers well to dive in and really look at some of the resources, some of the best practices that many of the companies have been using for some time now that can particularly be effective in this circumstance. If we could go to the next slide, please. So in speaking to the folks of the Job Accommodation Network, they've really had quite a lot of questions and calls about hearing and accessibility in regard to telephone calls, conference calls, and video conferencing. Really, as a result of reliance on telework, many workplaces are experiencing communication challenges with rapid transition that we've all had to go through. So supporting employees who are deaf and hard of hearing and who are working remotely may really require some planning and adjustment to existing accommodations so that services like CART, captioning, interpreting services can be provided effectively. And again, this may mean temporary leave till we can figure this out, right? I'm not just gonna put this person on permanent leave until the pandemic's over. I wanna figure this all out, but I need some time to figure it all out. So you wanna engage the person, you wanna engage resources from EARN or from JAN, and then kind of do, work through that accommodation process. So in these times when many people are teleworking, you really may want to consider when you're conference calling and video chatting using CART services or captioning support, or perhaps during conference calls and video chatting and interpreting support as well. I'd always suggest using the Job Accommodation Network. And they can more intimately understand your situation for your industry and that person's job within the industry and give you very specific information during their one-on-one consultation with you. So next, I'm just going to very quickly, so that we have a couple minutes for questions. Next few slides are resources. So you can rely on these within the PowerPoint presentation, but the one that I will point out, the one that I really want to point your attention to. So if we could go to the third slide of resources. Let's see. Nope, I am wrong. I want to go to the fourth resource. So the fourth resource on here, which I think is the best, and the EEOC is doing a tremendous job right now, listening to your questions and answering your questions. So the first bullet under the first bullet, the publication is What You Should Know About the ADA, the Rehabilitation Act, and COVID-19. This is a series of Q&As, very authentic, I think very legitimate to the workforce as to how I know the workforce and to what employers, the kinds of questions that you are asking. And not only that, but it gives very clear and concise answers. It's not bureaucratic, it's very, it's very clear language, very concise, and very practical advice to what to be doing right now. And as I said, the questions are just right on as far as I'm concerned. So we just want to let you know that the Department of Labor is really committed to protecting the health and safety of American workers and providing resources to help workers and employers prepare for what we are still seeing with the COVID-19 as you reopen your workplaces. If we could go to slide 30, please, the next slide. So let's end this webinar on a high note. Going forward, we want all people with disabilities to be proud of who they are and of all of their various identities. To circle back to this year's important anniversary, the ADA has ushered in really a new era of opportunities for Americans with disabilities. It is said that people with disabilities have equal rights to many freedoms most people have always taken for granted, including the very important opportunity to work. From there, the foundation was laid for a more inclusive American workforce and in turn, a stronger American workforce. And we appreciate all of your efforts at the Chicagoland Disability Inn and really moving this agenda forward. President George H.W. Bush emphasized in his remarks he delivered when he signed the ADA in 1990. And his sentiments still ring true today. And I'm particularly struck by what he said to the business community that day. And he said, "You have in your hands the key to the success of this act. If you can unlock a splendid resource of untapped human potential that, when freed, will enrich us all." And I believe that's as apt then as it is today, as we are still very much on our journey. So really, I'd like to close before questions by just thanking you for helping to unlock that potential, for really fostering inclusion in your workplaces, and for advancing the spirit of the ADA in your workplaces, your clients' workplaces, and beyond. So thank you very much. Really appreciate it.
Thank you, Lou. First, just to pass along to you, I have already been getting fabulous feedback on your presentation, the slides, and just so that everyone knows, we will be sharing both the slides and a link to a recording of the session afterwards. So you'll get all that email either tomorrow or the next day. So I do have a couple questions for you.
Sure.
First, if an employer chooses to put an employee on temporary leave while working through an accommodation process, is the employer required to pay that employee?
That is a really good question. And that's a question that I really have to take back. So thanks very much. Thanks very much for that first question. I do believe the EEOC has some guidance, and I think that's one of the questions that they answer. But let me get back with you on that, and we can send any responses. And I also want to open it up. If there's other questions that we don't get to too, by all means, let's submit those and let's get answers to them, and we'll get them out to everyone.
Wonderful. So, and I think you will all see on the last slide, which we will share with you, we've got Lou's email address. So if you have questions that you didn't think of while we were here this morning, please feel free to share those as a follow-up. And then the last question I have for you, Lou, given how quickly things are changing and how the guidelines are changing very quickly, do you have any suggestions on how best to manage that, or are there kind of best practices that professionals should be looking to help make sure that they're as up to date as possible on what they need to know about various accommodations?
Sure. And what I try to do too is, again, as I spoke before, it's the challenge of integrating all of these, looking at the CDC list and seeing who might be exposed and who's on this list that has a serious health impairment that I might want to consider protections for in the workplace. But you know, beyond all of the laws, all of the regulations, and all of this guidance, I think it's common sense. And I really think if you have a strong accommodation foundation that you have put in place, and you have been doing this, you know, successfully, I think that hasn't changed. The accommodation process is the same. So I think you just have to kind of broaden your perspective on how to do this in COVID times. I think it's the same type of analysis, the same due diligence. I think the same concern for your employees that's expressed in the ADA. I think that's the approach. So I really think that's the best way to approach it. I really do.
Great. And I have one more question that just came in.
Sure.
Given the dependence on virtual platforms and the fact that so many people are working from home right now, are there any current or anticipated impact on online accessibility and access?
There's you know, I think there's an enormous impact in terms of digital accessibility. I tried to cover a little bit of those because I think what the biggest effect we're having right now is, you know, is Zoom, is WebEx, is Teams. You know, how are these tools that we're communicating, how are they accessible? Or how do we complement them with art, with captioning to ensure they're accessible? And really, I think that's what we're working through right now. I would suggest that we do have one DOL resource that is called, if you haven't visited Pete Works, there are documents specific guidance specific to COVID-19. And it does look at the digital accessibility issues that we're having. So, you know, I think what it's really forcing us to do is forcing us to very quickly look at issues which have been on our back burner and which have come to our front burner a few times. But I think now it's really forcing the issue of digital accessibility and ensuring that our website tools, our conferencing tools, our learning management systems, our recruiting systems, that they are all fully accessible. So, you know, are our videos captioned that we're using to do onboarding, you know, all of these different issues. So it's sort of warp speed that we're not only confronted by all of the digital accessibility issues faced, but how do we put these solutions in place very quickly?
One last thing, and then we'll wrap it up. Could you just quickly repeat that DOL resource that you just mentioned?
Sure, and that's it's Pete Works, so it's peteworks.org.
Great, P-E-A-T?
Yes, well, yes, PEAT, exactly, yeah. And you know, I will send that along with the resources so everybody, and what I'll do too is I'll send some links to our resources, but what I'll do is I'll make them very specific to the public people need to go through, just to make it a little bit easier, since I know you're, at this point, all the employers out there are reviewing numerous documents, so.
Wonderful. So we're just about at the top of the hour. I first want to thank you, Lou, for such a timely and engaging presentation. You've done a fabulous job of taking some pretty dense, complex, and kind of anxiety-inducing information and putting it together in a very helpful and constructive way. So thank you for your time. I also want to thank Deborah from the Shirley Ryan Ability Lab, Robin Jones from the Great Lakes ADA Center. I want to thank all our Disability in Chicagoland partners who have joined us today, and those of you who aren't currently partners of Disability in Chicagoland, if you have questions about it, please do feel free to reach out to me. So our last slide here, you'll see follow-up information, some ways to contact either me or Lou or Deborah for more information about the presentation. I will be following up with all of you to share the wonderful resources, both the slides and the recording. And again, thank you to all of our participants. We know that you could be doing a lot of things with your time, and you certainly have a lot of asks of your time. And I really appreciate you making the time to spend it with us. So Thank you, everyone. I hope you all stay well and healthy, and we'll look forward to seeing you again soon.
Take care. Thank you for the
Take
opportunity.
care.
Bye-bye now.
Bye.
Thank you.